Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this video, the doctors talk to you about anal fissures.
Hello, I'm Dr. Jessica Enix. I'm a board-certified general surgeon with Surgical Partners of Oklahoma, and I'm here with my friend Dr. Pooja Singhal, a board-certified gastroenterologist, and we have been doing some segments on perianal health and pelvic health. And today, something we really wanted to talk about is the common complaint of anal pain and perianal pain. Welcome, Dr. Singhal.
Thank you, Dr. Enix. It's a pleasure to be here talking about what we are passionate about is perianal pain, anorectal health. So let's get right into it.
Okay. So one of the common complaints that I get to see in my office is a complaint of pain, and oftentimes pain with bowel movements and bleeding. Almost all of these patients come in with a diagnosis of hemorrhoids, have often been started on hemorrhoid creams, but surprise, surprise, when we do the exam, there are no hemorrhoids to be seen. Have you come across this?
Yes, I absolutely have. And I completely agree. This is so important to talk about because it is very often very common to confuse hemorrhoids and other etiologies like anal fissure with the symptom of perianal pain. So yes, the answer is yes. I get so many referrals for perianal pain, and it's so important to do a very good physical exam. And I want you to talk about how you do your physical exam, and then I can share what I do in my clinic as well.
Yes. So the reason I love talking about this topic is because this is one of those types of surgical interventions that carry a decent amount of risk if we are forced into the operating room. So operating on anal fissure is something that most surgeons don't love to do. And so if we can keep from it, we really prefer to do so. And one of the common issues is that a patient comes in, has not been fully examined by the person that provided them the hemorrhoid cream. They've started this treatment and usually tell you something like, it burns when I apply it, I am having more pain, and I am still bleeding. The problem is that not only is the treatment not working, in fact, the treatment is likely making the symptoms worse and creating what would be called an acute anal fissure, a chronic anal fissure. So when I see these patients, I spend a lot of time in the interview process. When do you have the pain? How would you describe the pain? Oftentimes it's described as a sharp, almost heartbeat type sensation in the bottom at the tip of the tailbone. And unfortunately, oftentimes described as razor blades coming out of the bottom of the bowel movement.
Yes.
Now, hemorrhoids can hurt, right? Hemorrhoids usually do not get described as knives or razor blades coming out of the bottom. And that's usually a big indicator that we're not dealing with hemorrhoids. And then after this discussion, we do an exam that also includes a rectal exam looking at the tissue on the outside. Something that can be really deceptive about an anal fissure is we mostly get these along the back side of our bottoms. And if we keep getting them, we can develop some scar tissue called a sentinel pile, which oftentimes looks like an external hemorrhoid.
Yes.
But that's not what it is. It's scar tissue from the body trying to heal itself up. And at the time of the exam, if I'm concerned that a patient actually has an acute anal fissure, I will not perform a digital rectal exam. That is extremely painful. And the exam can be simply elicited by pushing around the edge of the anal verge where the sphincter muscle is to figure out where the fissure is.
Yeah. Well, wow, there's so many good nuggets in there in what you just talked about. So I'm going to highlight a few things that you just mentioned. One, so just for our audience who's listening, anal fissure simply means a cut in the anal canal. So I often talk to my patients that it's like a paper cut at the worst possible place on your body.
It's a fantastic way to describe it.
Yeah, because it's a paper cut in an anal canal. And unlike where if you get a paper cut on your finger and you can heal it and seal it off with a Band-Aid, we can't stop using our anal canal. We're constantly using it. And there's no way for us to kind of seal that area of paper cut to be like, okay, now you go rest and heal. And that's why what Dr. Enix so eloquently mentioned, it's very important to diagnose these earlier on and in a correct manner.
Correct.
Because an acute fissure, which just means that the fissure just happened, could lead to chronic fissuring and chronic fissure disease. That's the reason why, because we can't really just seal it off. You're constantly having that fecal stream and using that area. The other important thing that you mentioned, which is so important in my opinion, is the history, the importance of history. You know, are you having pain with defecation? The razor blade, that's such a good way to describe it. That if you're feeling like and I hear that all the time, the razor blade's coming, or the feeling of razor blade as you're passing stool, then there is something more than hemorrhoids, like you mentioned. And I think another important thing that I want to highlight in what you mentioned was the importance of exam, yet being very careful as to not traumatize the patient. Because if they truly have the fissure, if they truly have the paper cut, by doing a digital rectal, you can really cause a lot of pain and discomfort and really traumatize somebody.
Yes.
And so I really agree, and that's what I do in my practice too, is the appearance and kind of just holding the buttock and really having a good visual examination. You can find that location of the anal fissure, and then you also touched on how commonly the most common location is that posterior part of our anal canal, where the radiation is towards the tailbone.
Yes.
So you feel the referred pain in your tailbone.
Yes.
So I thought that was really fantastic. So how do you approach the treatment, Dr. Enix?
So I hope that I've been referred the patient quite early, and we haven't been doing anything like hemorrhoid creams, because hemorrhoid creams by nature usually have medications in the cream that constricts the blood vessels, which is good for bleeding hemorrhoids, and also a steroid, which can decrease inflammation, but steroids don't allow us to heal.
Yes.
And so it's kind of this double whammy that can happen when we're dealing with an anal fissure. Yes. So if, unfortunately, the patient has been trialing this, we stop that immediately. And then we start working with things to help with pelvic relaxation, anal sphincter spasming, and then, of course, pain relief.
Yes.
So constipation is commonly associated with this. So that's also another thing that we do have to treat. However, when it comes to medical type interventions that we can do outside of surgery, warm baths and heating pads, you can imagine it's a very sensitive muscle. Those things allow us to decrease the spasming of that muscle, which decreases the pain, and then honestly can just simply allow that muscle and tissue to relax and allow it to slowly heal over time. Then the next step that I like to use is a vasodilator. Many years ago, the big option that we had was a nitroglycerin cream. Came with some side effects like headaches and some issues like putting it on your bottom and standing up and almost passing out. So now I try to use something called nifedipine cream, which is a compounded formula that does something very similar to nitroglycerin.
Without the side effects.
Yes. Without those side effects. And honestly, I have really, really great results with that. I would say 70 to 80% of the patients that I treat that way will have drastic improvement. Okay. And if that doesn't work, we can trial perianal Botox injections, which, depends on how much the patient wants to trial something outside of surgery.
Wonderful. Yes. I mean, I think you hit on all the wonderful things there in terms of treatment options. Do you do a compounded ointment? That's what I tend to do.
I do.
Yeah.
I do.
Nifedipine and with petroleum jelly and your antispasmic
Yes.
medication.
That's exactly what I
Yeah.
do.
So just to kind of reiterate, so the treatment options that are important to consider and know about is, again, avoiding straining, treatment of constipation with stool softeners or fiber, medical pharmacological treatment, which is a combination of medications that we just talked about, which includes a vasodilator like nifedipine, an ointment to soothe and promote healing, and an antispasmodic medication, and then things like the sitz baths or, anything that's going to help reduce that spasm.
Yes.
Anything else you'd like to add about anal fissures and perianal pain?
Well, so if all of those things get exhausted and they do not fix the problem, there is a surgical option.
Please tell us about that.
So the surgical option, the most common type is called a lateral internal sphincterotomy. But many surgeons and patients shy away from it because it does involve us cutting the anal sphincter muscle in half. So it carries a risk of being unable to hold in your bowel movements. The risk is very, very low, but it's not zero. And that's why I am so passionate about education in this area, because if we can find the problem, treat it quickly,
Yes.
then we can keep surgery off the table and any of those risk factors. If anal fissures are in different locations than the back of the bottom, the posterior location, there are other surgeries that involve advancement flaps that can be done by specialists. But it becomes quite a substantial surgery pretty quickly.
Sure. Well, thank you so much for being so passionate about this topic and most importantly, concentrating so much on the prevention and early diagnosis and treatment to, really try to avoid more invasive methods that require longer recovery. So thank you. And I hope this was very helpful.
Yes, thank you. It was wonderful talking with you.
Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please contact us at SheTV.com if you have comments or a particular subject you would like us to address.